Good day, everyone. We're coming on the air to bring you a major development of the battle against the COVID-19 pandemic. A key FDA advisory committee has just voted to recommend emergency use authorization for the Pfizer vaccine.
A CDC panel says healthcare workers and nursing home residents should get the coronavirus vaccine first.
There is some really good news. New cases of coronavirus in nursing homes across the country fell nearly 90% in 8 weeks.
The vaccine didn't just work, it worked amazingly well. And case counts have now dropped to virtually zero, and really demonstrates that when our residents and our staffs are made a priority, very good things can occur.
Prioritizing nursing home residents is at the heart of a bold new plan from the profession called the Care for Our Seniors Act. Industry leaders are calling for substantial reforms to nursing homes in order to address systemic challenges and prevent another tragedy like the COVID-19 pandemic. First, the Care for Our Seniors Act seeks to enhance the quality of care delivered by focusing on the roles of clinicians and better preparing for viral outbreaks.
If we don't learn from this pandemic, then we're doomed to replicate the same problems. We know that having 24-hour registered nurses in a facility really help improve outcomes, and we saw that with COVID. We need an infection preventionist in our building, and we need it tailored to the size of the building and the people you're taking care of. And then I think we clearly learned that we can't rely on a stockpile in PPE, which is giving out to hospitals and everyone else. So we need these reforms.
To address workforce challenges, the industry is advocating for a multi-phased approach to attract and retain more individuals to develop a career in long-term care.
We need our federal and state policymakers, as well as our academic institutions, to help us build up the next generation of caregivers. We can support our caregivers directly with financial assistance programs like loan forgiveness, tax credits, affordable housing, and childcare. And we can incentivize higher learning institutions to recruit and train more caregivers for long-term care through subsidies and funding.
Additionally, the plan suggests it's time to revisit how the government monitors and mostly penalizes nursing homes for their practices.
It just doesn't make sense to impose this very punitive system on providers that are doing a good job. So it's really about doing what needs to be done for the resident, not about catching people making minor mistakes and then fining them, which is what the current system does. It's time now to develop a collaborative process.
Lastly, the Care for Our Seniors Act calls for a review of how to modernize nursing homes and offer more private rooms to residents.
These older nursing homes need to get with the times, and residents deserve increased privacy and dignity. At the same time, more private rooms would help support infection control and prevent something like COVID from happening again.
While these reforms would be costly, they are long overdue, and nursing homes need the help of policymakers who hold the purse strings to make these lofty goals a reality.
We're going to have to make a commitment to the elderly and to the people that live in our facilities that they are a true priority. And by making them a true priority, we will pay the cost through Medicaid to take care of them. We won't underfund it as we are doing right now. For that to happen, we need the policymakers both in DC and in the state capitals to step up and provide the care that these people so justly deserve.